Hi Tina, how are you today?
Hey,
I'd like to assess you. Is it okay if I examine you?
sure.
Okay. All right, first we're going to check your vitals. Let me see your blood pressure is 128 over 82. We've got a 78 heart rate, 15 respiratory rate temps, 37.28 febrile, and a 99% SpO2. Then next what we're going to look at is your spirometer. So let's see how you do with this. Can you blow into the spirometer, please? Okay, results are 1.549, and that's divided by 1.78, so it's over 80%. So it's unlikely that she has any sort of respiratory issues right now, or asthma, or it's controlled. Okay, let's go back. Okay. Next, I'm going to actually assess your head. Okay, so we're going to palpate your scalp. Okay, so I look at her head. She's got a normal cephalic head. It looks like she has normal hair distribution. I didn't see any bruises, no rashes. We're going to palpate it now. And on palpation, I don't notice any lumps or any masses. Next, we're going to take a look at, just take a general look at her face. So we're going to inspect her head. You can see that she has excessive hair growth right above the lip, upper lip, and also has papules scattered all over her face. She did complain about acne, and you notice her eyebrows are equal, and we look at her face and she has a symmetry to her face. So we'll go back. Next we're going to inspect her ears. Okay. So looking at her ears, we notice there's a little excessive hair growth to the side. Again, the papules you can see, and we'll look at the other ear, and we're seeing the same thing, excessive hair growth in the papules, and the ear is intact. There's no redness, no drainage, nothing like that. So after we did that, we're going to now use the otoscope to take a look in her ears. And we're going to look in her ear, and we see that she has the tympanic membrane is intact. It is pearly gray, and she has a cone of light that is at 5 o'clock with the malleus right here. There's no redness, no swelling, and we don't see any exudate. So we're going to look at the left ear. In the left ear, we notice also that the tympanic membrane is pearly gray. We do see the cone of light at 7 o'clock and the malleus right here for the tympanic membrane, and there's no inflammation, no redness, no swelling, and no drainage. Next, we're going to look in her nares, and we notice in her nares that in her right nares she has pink. There's no drainage. We also notice that it is midline, and we can look over here and we see that also her nares is pink, moist, no drainage, and the septum is midline. The septum is midline for the right side too. After we looked at that, we're going to take a look at her eyes. So we inspect her eyes, and we can see that she has equal hair distribution. She doesn't have ptosis. Her eyelids droops both sides. She has equal hair distribution where her eyelashes are. We don't see her sclera looks to be white, and there in her conjunctiva is pink, moist. There's no tears, no lesions, nothing whatsoever in the eyes. So we're going to go back and we're going to inspect her eyelids. No lesions, they're pink, moist. We'll look at the bottom. And look at the bottom. We don't see any lesions, no moisture, nothing like that. So we're going to go back. And next, after we looked at the eyes, we're going to assess them. We're going to assess eye movements. I want you to follow my finger with just your eyes. Okay, we're checking for extraocular movements. Extraocular movements are intact. There's no nystagmus. Going down, we notice that she does have convergence, so there's no issues there. After we tested the eyes, we're going to go and we're going to use the pen light to check her pupil reaction. So we're going to check her pupil reaction, and we notice she has consensual light reflex of the pupils. Both of them constrict at the same time. We're going to check the other side. And we notice that this pupil also does restrict too, or constrict too. Next, we're going to check her eyes with ophthalmoscope. And we're going to look at her in front of her eye. We're also looking, we see that the pupil is round. Again, as I noted before, the sclera is white and the conjunctiva is pink, moist. There's no lesions in the eye. We're going to look at the fundus next, because this gives us an idea of the blood vessels and everything. And a lot of times with people with diabetes, you can end up with diabetic retinopathy. And in this patient, we notice mild diabetic retinopathy. We can actually see cotton wool bodies, and those are an indicator of diabetic retinopathy. There also might be very small, they don't look like they're hemorrhages, but they could be. But it looks like this is very mild changes in diabetic retinopathy. And so this may be caused by damage from poorly controlled blood sugar. Next, we're going to look at her left eye. And again, we look and we see that the sclera is white. The conjunctiva is, there's pink, and there's no lesions in this eye. As we look further in, we notice that this is a healthy eye. We have defined disc margin right here, and we also have good blood vessels. There is no hemorrhaging. I don't see cotton wool bodies over here, and it looks like this is a healthy eye. Okay. Next, we're going to check our visual acuity. Okay, I'm going to read some lines, and I want to check your visual acuity, Tina. First, we're going to have you cover your left eye, and I want you to read this line right here.
I can't read that line. It's too little.
Okay, well, let's check the next one out. Can you read this line?
D-E-F-P-O-T-E-C.
Okay, that's good. Let's cover the right eye now. Okay, and we'll check the left eye's visual acuity. Can you read this line this time?
I can't read that line. It's too little.
Okay, let's have you read this line then.
D-E-F-P-O-T-E-C.
Okay, and let's have you uncover that eye now too. And we're going to have you read this line one more time.
D-E-F-P-O-T-E-C.
So what we found is that in her right and left eye, she has 20/20 vision. This is 20/20 vision with corrective lenses. Next, what we're going to do is we're going to take a look at her mouth. We're going to inspect your mouth and your throat. Now first we're going to press the tongue. We're going to look for any sort of any discoloration, any sort of any sores or anything like that, and also dental caries. And we can see that the tonsils are not enlarged, and everything is moist and pink. There's no redness, no erythema, and no drainage, no postnasal drainage, and no discoloration. When we pull up the tongue, we also don't see any lesions, no discoloration. And when we push to the left, no lesions, no discoloration. Push to the right, no lesions, no discoloration. And we're going to test her gag reflex. And she's got a good gag reflex. So we come back. And next thing we're going to do is we're going to check her TMJ. This is temporomandibular joint. So we're going to have her open and close your mouth. Tina, can you open and close your mouth? Good job, okay. So when she opened and closed her mouth, we noticed that she had a full range of motion and there were no clicks. Okay, next what we're going to do is we're going to palpate her thyroid. And on the palpation of her thyroid, we note that she does not have an enlarged thyroid. There's smooth, there's no nodules, and no goiter. Okay. Next what we're going to do is we're also going to palpate your sinuses. And so we're going to palpate the upper sinuses first, and we notice that she has no pain and no pressure. We're going to palpate the lower sinuses, and there's no pain reported. Okay. Next, we're going to assess her peripheral vision. And tell me when you can no longer see my fingers.
Okay, I will. Now.
Okay, she's got good peripheral vision. Okay. Okay, so next we're also going to test her, we're going to perform a whisper test. Check her hearing.
F 8 W.
And we're going to perform a whisper test on the other side, the left ear.
4 R 9.
And so she can hear well. There's no problem with the whisper test. After that, we're going to go back and we're going to palpate our cervical lymph nodes. And we palpate the lymph nodes. We don't feel anything. We're going to palpate the supraclavicular lymph nodes. And on palpation, we noted no palpable nodes. And last, we're going to palpate her axillary lymph nodes. And we note no palpable nodes. Next, we're going to be checking her cardiovascular system. And first, we're going to palpate her carotids. Yeah, we're going to palpate her carotids. Okay, it's a 2+, no thrill. Okay, then we're going to auscultate our carotids, carotid arteries. And we notice there's no bruit. And then we're going to palpate the other carotid artery, her left carotid artery, and there's also no bruit. Okay, after we check that, we're also going to check range of motion in her neck. So let's get neck range of motion. Just have you tilt your head back and look forward to the ceiling. Start. Okay, good range of motion. Tell you do flexion. Touch your chin to your chest. Okay, that's good. Lateral bending. Touch your shoulders with your ears. Okay, and we're going to check rotation. Okay, so she's got good range of motion in her neck. I'm going to check rotation, rotate it from side to side. Alright, good rotation. Okay. Okay. I'm going to go back and okay, next we're going to check her cardiovascular system. Again, we're going to be listening to her heart. We're going to auscultate her cardiac points. I'm going to lay down for this. And we're going to auscultate her aortic area with the diaphragm. And what we hear is we hear S1, S2 sounds. We don't hear an S3 sound and no murmurs. Then we're going to auscultate her pulmonic area with the diaphragm. And again, we hear S1, S2 sounds, no S3 sounds, no murmurs. We're going to next auscultate Erb's point with the diaphragm. We're actually going to flip this over the bell because you can hear murmurs with this. And we hear S1, S2 sounds, no extra sounds and no friction rub. We're going to next go to the tricuspid area with the bell. And again, we hear S1, S2 sounds, no murmur, and no S3, S4 sounds. And last, we're going to auscultate the mitral area with the bell. And again, we only hear S1 and S2 sounds. A regular heart rate. Okay. Next, we're going to auscultate her, or palpate for her PMI. This is a point of maximum impulse. Okay, we palpated an anterior chest. The PMA is non-displaced, and there's no heaves or lifts, which is good. That's what we want. Okay. Next, we're going to listen to the lungs. Next, we're going to, well, first we can inspect the anterior chest. And the anterior chest looks good. The skin looks good. It looks, there's no redness, no swelling, no rashes, no papules. I don't see any sort of scars or moles. And we'll inspect the posterior chest. And again, I don't see any rashes, moles. There's one mole right here, but I don't see any sort of lesions, anything like that, or scars on her back, or rashes. Then we're going to auscultate her anterior chest. going to start up in the right upper anterior chest wall, and we hear bronchovesicular sounds. Then we're going to listen to the left anterior chest wall, and we hear bronchovesicular sounds again. And we're going to listen to the middle anterior chest wall, and we hear bronchovesicular sounds. And we're going to listen to here we hear bronchovesicular sounds, and then we're going to listen down to the right lower anterior chest wall. We hear vesicular sounds, and then we're going to listen to the left lower anterior chest wall. We hear vesicular sounds, and these would be expected to be heard. And we're going to go back, and now we will auscultate the posterior chest. And again, we hear bronchovesicular sounds. Bronchovesicular sounds in the right and left posterior chest wall. And we hear vesicular sounds in the middle left posterior chest wall. And vesicular sounds in the right chest posterior wall. Vesicular sounds in the lower left posterior chest wall. And auscultated lower right posterior chest wall and heard vesicular sounds. And then also in the bases we're hearing vesicular sounds. Okay, so lungs have been auscultated. Next we're going to auscultate her abdomen. So we're going to inspect it first. And we note that the patient has a protuberant abdomen with a little bit of striae, and also looks like no moles, no rashes, no scrapes. So next we're going to auscultate the abdomen. We're starting the right lower quadrant. And we hear normal active vowel sounds in the right lower quadrant. So we're going to listen to the right upper quadrant. And we hear normal active vowel sounds in the right upper quadrant. Then we're going to check the left upper quadrant. And we hear normal active vowel sounds in the left upper quadrant. And we're going to check the left lower quadrant. And we hear normal active sounds in the left lower quadrant too. So we're going to go back. Alright, so we assessed and listened to the hearts, the lungs, and the bowels. And now we need to palpate and listen to the vessels too. I do also want to auscultate the abdominal arteries. We're going to start with the aorta. We notice no bruit. Auscultated the right renal artery, no bruit. Auscultated the right iliac artery, no bruit. And auscultated the right femoral artery, and there's no bruit. And we're also going to auscultate the left renal artery, no bruit. Auscultate the left iliac artery, no bruit. And auscultate the left femoral artery, and there's no bruit. So this tells us we have good blood flow. Okay. After we auscultate, we want to palpate or percuss. So the next thing we're going to do is we're going to percuss. We're going to start out with the respiratory system. I believe let's go back. Yes, we're going to start out with the respiratory system, and we're going to palpate for tactile ephremotus. First, we're going to do it anteriorly.
$99.
Okay, and we hear equal bilaterally in the lower anterior chest wall. So let's go back. Now we're going to do, we're going to palpate for posterior ephremotus.
$99.
And we get equal bilaterally in the middle, upper, and lower posterior chest wall. Okay. Let's go back, and now we've palpated for ephremotus. We're going to palpate for symmetric expansion for posterior. And the thoracic expansion is symmetric. So we're going to go back there, and now we're going to percuss. We're going to percuss the anterior chest first. And we hear resonance over the lungs. Which would be expected. And then we're going to percuss the posterior chest. Okay. And over the whole posterior chest and the anterior chest, we notice that there is resonant sounds, and so that's what we would expect on palpation or on percussion. Okay. Next, we're going to go to cardiovascular system, and we want to palpate the peripheral pulses, the upper ones first. The right brachial pulses are +2, and we're going to palpate the radial pulse, and those are also +2. Okay. And the left radial pulse and left brachial pulse were also +2, that are strong. And we can also check cap refill in the fingers. Cap refill is less than 3. Okay, nail beds look pink. An uncap refill on both hands is good. It's less than 3. That's what we'd expect. Okay. So now that we did that, we can go next to the gastrointestinal system, and we're going to now percuss and then palpate. So we're going to percuss the abdomen first. Okay, we percuss the lower quadrant, it's tympanic, and that's what you expect. Again, the right upper quadrant was tympanic, left upper quadrant is tympanic, and the left lower quadrant is tympanic, and we're going to percuss the left anterior axillary line, and that is also no dullness, and so we know the spleen is not enlarged, not present there. We're going to next assess for CVA tenderness. And there's no CVA tenderness reported. And then we're going to percuss the liver span. And what we learned is the liver span is 7 centimeters, medium clavicular line on percussion, and that's normal. That's where it should be. We go back, and now we can actually perform palpation. So we can do a light palpation of the abdomen first. Let's do that. As we palpate the right lower quadrant with light pressure, and there's soft, and there's no masses. Now palpating the right upper quadrant, and that's soft, no masses. We're going to palpate the left upper quadrant, and that's also soft, and there's no masses. And then the left lower quadrant, and it's also soft, and there's no masses. Okay, we do notice that there is a little excessive abdominal hair, and this is again, she was talking about a striae on her abdomen, but she was talking about having excessive body hair. Next, we're going to palpate her organs. And so first we will palpate for the right kidney, and it's not palpable, there's no masses. We'll do the left kidney, and it's not palpable, there's no masses. And then we'll palpate for the liver, and we find that it's palpable 1 centimeter below the costal margin, and that's also normal finding. And then we're going to palpate for the spleen, and that's also not palpable, which is also a normal finding. And next we're going to do deep abdominal palpation. So we'll start in the right lower quadrant, and on deep palpation we notice no masses, no pain. I'm turning to the right upper quadrant, and there's also no masses and no pain. Left upper quadrant, no masses, no pain, and then the left lower quadrant, there's no masses and no pain. Pushing it back. Okay, next we're going to go to, I'm going to start moving further down, and we're going to go to the neurological level. So we're going to check some neurological skills that you have. Before we do that, let's assess your cardiovascular system. We're going to palpate. We're going to palpate your peripheral pulses, your lower peripheral pulses. So let's do that. Okay. So I'm palpating the right femoral pulse, and it's a 2+. Okay. Palpating the left femoral pulse. It's also a 2+. I notice on the assessment there's no lesions. I don't see any rashes, or no papules, no scars. Palpate left femoral pulse, 2+. Palpate right popliteal pulse, 2+. Palpate left right tibial pulse is 2+. Palpate left tibial pulse is 2+ strong. Also going to palpate the posterior tibialis, or dorsalis pedis, and that's 2+. And then I'm going to palpate the left dorsalis pedis pulse, that's also 2+. We can also inspect the legs, and we notice there's no swelling, no edema, no redness, no dryness of the skin or anything like that. We also can assess her capillary refill of her toes, and less than 3 seconds. And less than 3 seconds, so good capillary refill. And then we can also go and we can assess some neurological stuff. Well, first we can do some musculoskeletal things. We can check for range of motion in her knee. She's got good range of motion. 5 out of 5. Go back. We'll check. We already checked her neck strength. She had good range of motion in her neck and good strength in her neck. So we're going to check her bicep strength. We're going to have her pull her forearms. Pull your arms, please. And she's got 5 out of 5 strength. And we're going to have her push her forearms. And she's got 5 out of 5 strength. Then we're going to check her ankle strength. And on plantar and dorsiflexion, she has 5 out of 5 strength. We're going to assess her hand strength. And we'll have her to her wrist down. And then grasp fingers. And she's got wrist strength of 5 out of 5, and she can also grasp the fingers. So we'll go back and we're going to assess her hip strength. And hip flexion is a 5 out of 5. And then we're also going to assess her shoulder strength. And she's also got a 5 out of 5 for shoulder strength. Next, we're going to assess her range of motion for her wrists, her ankles, her spine, and her hips. Assess her wrist, abduction, and adduction. Turn your wrists and bring your fingers together and then apart. Okay, good. She's got good full range of motion. We're going to check extension of the wrist. Good, she's got extension, and we'll check flexion. Okay, good, and flexion. She's got full range of motion of her wrists. Next, we'll check her ankles, and check for eversion and inversion. She's got good movement of both of her ankles. Range of motion is good for eversion, inversion. We're going to also check extension and flexion. And she's got good range of motion for extension and flexion. And then we're going to assess her range of motion of her spine. I'm going to see if she has good extension. Come back as far as you can. Good. And she's got full range of motion and extension of her spine and flexion. And she's got good flexion too. And we'll check lateral bending. She's got good lateral bending, and we'll check rotation. Okay. And she's got good range of motion with rotation. So full range of motion in her spine. Next, we'll check her range of motion in her hips. I'm going to check for if she can do abduction. Okay, and she's got good abductors and abduction she's able to perform with her hips. Then we'll have her bring her leg underneath the other leg and check for adduction. And she's got good adduction, full range of motion, and extension. And she's got good extension of her legs. And we're going to check flexion of the hips. And she's got good flexion. Okay. Next, we're going to check her range of motion of the elbow. Check for flexion and extension. She's got good flexion and extension. And supination and pronation. And good supination and pronation. Good range of motion there. We're going to assess the range of motion of her shoulders. We're going to check for abduction. She's got good adduction of her shoulders. Good range of motion. Extension. Put your hands behind your back. Just get good shoulder extension. And then flexion. Raise your arms in front of you and overhead. And she's able to do that too. So she's got a good range of motion of her shoulders. And then lastly, let's check her knees out. And she see what her extension of her knees are. And she can straighten her legs. Okay, she's got good range of motion of her knees. And then she's also able to flex her knees. And she's got a good range of motion in flexing her knees. Full range of motion. Okay. I don't see any abnormal swelling in any of her joints and any of her no bones, no issues at all. So her joints look fine. They look on this post, no deformity in any sort of her joints or bones. Next, we're going to look at neurological, and we're going to assess her motor skills from heel to shin. So I'm going to have you, next you'll test the point movements. I want you to move, run your right foot down your shin.
Sure.
Good. Now I want you to run your left foot down your shin.
Okay.
Okay, good. She's got good motor skills from the heel to shin. I want her to actually touch her nose too. Can you close your eyes and touch your fingers to your nose?
I can do that.
Okay, good. So she's able to close her eyes and she's got good motor skills. Okay. Now we're going to check her orientation. And we know that Tina knows her name and date of birth. We can assess this too. We've had a conversation with her before, so we know she's cognizant and she's alert and oriented times 3. But we'll ask her anyways. What is your name and date of birth?
My name is Tina Jones, and I was born on February 7th.
Yeah, and so we know that she's she knows where she's at. She knows that she came to this appointment, and that she's alert and oriented times 4 or times 3.
I'm at the doctor's office. It's Shadow Health General.
And she knows she's here because she came to do what she needed to do. So we don't need to assess that anymore because we know she's alert and oriented. We are going to assess her motor skills. I want you to place your hands on your knees. Oops. Your knees and turn them over.
Okay. Like this?
Yes, that's good. So she has good motor skills to her hands. And we're going to assess her lower pain. Close your eyes and tell me if the touch is sharp, dull, or soft. Okay?
Okay.
Okay, so we're going to use dull to the right leg distal.
Dull.
Okay. We're going to do left leg distal.
Dull.
And we're going to do sharp to the right leg proximal.
Sharp.
And then the left leg proximal. Okay. And then we're going to do dull to the left leg proximal
Dull.
and right leg proximal.
Dull.
Okay. And then we're going to sharp to the left leg proximal and to the right leg proximal. And she can tell it's sharp. And then last, we're going to check soft and do that to the left leg distal, right
Soft.
leg proximal,
Soft.
left leg proximal,
Soft.
and right leg distal. And she
Soft.
has good lower pain light touch response. It's intact. Next, we're going to assess her upper pain light touch response. Now we're going to do sharp. We're going to check her left arm proximal. And she says it's sharp. And do a soft to her right arm distal.
Soft.
And then we'll go soft to her chest.
Soft.
And do dull to her right arm distal.
Dull.
And she's got good sensations, good upper pain, light touch response. Okay, your back. And we're going to sense her. Close your eyes and say if your toe moves up or down.
Oh.
I think we're going to do left foot first.
Down.
And she's got good position sense. I'm going to go to right foot.
I think that was up.
And she's got good position sense with the right foot too. So we're going to go back. And last, we're going to look at her position sense of the fingers. Close your eyes and tell me if your finger moves up or down.
Okay, I will.
So she has good position sense. You can sense that it moved up, and we're going to also do the right hand.
Down.
Okay, and she knows it moved down, so she's got good position sense of her fingers. And we're going to use a monofilament to check her sensation of her toes. Close your eyes and tell me when you feel the touch. This is for sensation of her feet. So
Okay, I will.
with the monofilament, we need to definitely check this. So she has a decreased sensation in her right big toe, and that would be an indication that she may be developing peripheral neuropathy. There could be other reasons for this too, but she is diabetic. Now we're looking at the right distal, medial distal aspect of the right plantar surface of the foot, and she can feel that. And then we're going to look at the right lateral aspect of the plantar surface of the foot. And she doesn't seem to have sensation there. It's taking a long time, so there may be a little bit of peripheral neuropathy there too. And then we can also look at the heel.
Yes.
And she can feel that. So we'll look at the left great toe. And it sounds like she has diminished sensation in that left great toe. So we'll move down to the left distal or medial distal plantar surface of the foot. And it doesn't seem like she has any sensation there either. So we're going to move to the lateral surface of the distal foot. And we're also noticing that she doesn't seem to have any sensation there either. These are all diminished sensations. So we're going to check her heel again. And
yes,
she's got good sensation in her heel. So We know that now, and we're going to test her deep tendon reflexes or upper deep tendon reflexes. And she's got good 2+ reflexes on the right side. And DTRs are good. Brachioradialis is good. Triceps are good. And left side biceps are 2+, and the left brachioradialis is also 2+. So we're going to test our deep tendon reflexes of the lower extremities. And she's got good deep tendon reflexes. And check her left knee. And she's got good tendon reflexes. And we check her right Achilles. And then also her left Achilles tendon. And then last, we will need to check her graphesthesia. So we want her to close her eyes and tell me what you can trace in the palm. Close your eyes and tell me what I trace in your palm.
Okay. That's an A.
Okay, she's got good graphesthesia in the left hand.
A figure 8.
And she's got good graphesthesia in the right hand. So graphesthesia is intact. Now we're going to test the stereogenesis. So we're going to say close your eyes and tell me what I put in your hand. For
This is some wire thing. That feels like a key. Some kind of
and for the left hand, we'll do a coin.
coin.
And good stereognosis with a coin. Okay. And that seems to be everything. We already looked at the skin, and we looked at their face, and we saw that she has the papules in her face. We know that she has excessive hair growth. We checked all the skin in her body, and we noticed that she didn't have any sort of any hematoma, anything like that, any rashes, any scars other than the striae a little bit on her abdomen. We also noticed that her nails were pink, the nail beds were intact, there was no clubbing, and we noticed that she had no dry skin or, like I said, rashes anywhere. Hair is evenly distributed and displaced on her head and also in her eyebrows and her eyelids, and that is it. And that's the end of my recording.